and yesterday that have not allowed us to be able to come back and give you further information, but I think we have been updating that through the regular press offices reviews and notes. So since we were last here, we have identified a patient 5, a patient 6, and a patient 7. So I'll give you a brief snapshot on that, and then I guess we'll get through with the questions. The last time we were here, we had been talking about a mapping exercise around a patient number 4, but and I think we want to express the condolences to the families in terms of what happened with patient number 4. That mapping exercise, along with our expanded screening that we did on Saturday, is what allowed us to do what is a record in terms of number of tests conducted on Saturday. It's a total of 102 tests done in one single day. Most of those were from the mapping exercise from patient, as I said, number 4. And we had said we were going to scale up the testing. And so what we had done on that Saturday is we swabbed persons who were in the mandatory quarantine area in Corozal. That is what allowed us to identify a patient number 5 who remains asymptomatic in the mandatory quarantine area without any treatment. So that's patient number 5. We also did further swabbing of secondary contacts, if you will, or not so immediate contacts of what we had then as a patient number 4. And those tests were run on Sunday. That's how we managed to identify patient number 6, who we have established a link between patient number 6 and patient number 4, but we still have not been able to ascertain where or who the first case was in that regard. And the patient number 7 is a patient we swabbed because we had also said we were going to be swabbing people who were having respiratory conditions inside hospital facilities. So this patient number 7 is a patient who had been diagnosed with community-acquired pneumonia, initially managed in San Ignacio, and as per our referral protocol, he was subsequently referred to the Western Regional Hospital, which is where he was swabbed, where the diagnosis was made, and he was sent on to Carl Huchna yesterday in case he would have required any ventilation support. However, the last note I got is that he was not in a ventilation, he was not under mechanical ventilation, he was under supplementary oxygen, and that communication happens. We can't lose track, so we have therefore 7 cases. We have had 1 death associated to COVID-19. 1 patient is hospitalized, and the other 5 patients are being managed primarily from home. And I'm saying being managed because patient number 1 and 2 have remained virtually asymptomatic, as has been patient number 3, patient number 5, and patient number 6. Patients 1, 2, 3, and 6 are at home. Patient number 5 is in the mandatory quarantine area. So those patients remain, as I have said, virtually asymptomatic. If you go back also to our timelines, patients number 1 and 2 are being swabbed today, and that's to try to ascertain whether they are negative. And if you also will recall what we have said before, in terms of when you do, how do you declare somebody to be negative, it's you would have to have 2 negative results, which should be in 2 consecutive days, or we had said we perhaps are going to be able to do it not successive days because of we want to ascertain that people are in point of fact negative, but those patients are going to be swabbed today to find out if they are in point of fact having a first result that is negative. And patient number 3 should be swabbed through the weekend, early next week, because that's when the 14 days would have gone through. That's what we have in terms of this. The preliminary mapping exercise has been completed for both patients 6 and 7. For patient number 7 and 6, the immediate close contacts, those swabs were taken yesterday and they will be processed today. None of these two patients, just like patient number 4, had a clear indication of where they could have been infected, which is a little bit different from patients 1, 2, 3, and patient number 5, that you could connect them to an imported case. And that's part of the recommendations that have come through in terms of the Cayo district because of possible community spread and the fact that the 3 patients that we couldn't ascertain or peg them to an imported case are from the same community. So if you go back to also the plan we have been sharing, then that would entail that we are moving towards potential community transmission. So what you do now, you move your plan to a containment measure in that regard. So that's what we do. In terms of mapping, I think it's important because we have been getting lots of calls of people saying, well, I think I need to be tested. We did say, and I think Prime Minister reiterated yesterday, that we are going to scale up the testing, and part of that entails testing any healthcare worker that is having the flu, testing every 10 sample of any flu case that is showing up at the facility, and random testing of frontline personnel. Understanding that we have now gone 2 weeks into the border being closed, the airport at least, western border a little bit longer, and the northern border, well, we are just going into starting week number 2 of that. So that's where we are in terms of mapping exercises. You don't also test all the contacts, because what you do is you do classify your contacts into what's a casual contact and a close contact, and then you also stratify the risk, high risk, medium risk, and low risk in your first exercise, because no country, well, 2 countries only have the ability to test just about everybody. You will test primarily those high risk persons. That doesn't mean that if they get a negative result, they are in the clear. They still have to go 14 days into their quarantine, and then they will be checked 14 days thereafter, or if they develop any sign or symptom, which is what had happened with patient number 1 when a close contact, initially negative, started developing signs or symptoms, was screened, was still negative. That person then will be screened at day 14, as is the norm, before you can be declared to be COVID-19 negative. And one final thing in terms of mapping, some mapping exercises are easier than others. And I can use perhaps the example of patient number 5, because he came and immediately was taken to the quarantine facility. Then your exercise only talks about 2, 3, max 4 casual contacts, not high-risk contacts, because he went immediately to a room and has remained there. But when you have a patient like patient number 7 who is currently hospitalized, and since he has been ill and hospitalized for 6-7 days, then your mapping exercise extends not only to that 6-7 days inside a hospital, but the days prior to him becoming in, and then that's how you build up your timelines in that regard. So not everybody is necessarily going to be mapped in that regard. In terms of testing, well, you know, we have 7 positives. We managed to do 45 more samples yesterday, so that puts us more than 300 tests. I don't have the rate here in front of me, and we had shared an infographic on our social media page. That graphic should be updated every day at 3 p.m. or thereafter. We're going to have that as a cutoff value. Graph gets updated and it's shared. Now we are trying. If you notice, that has been modified as we have moved along. The graph is not intended to be a catchy graph for people to just observe, but it's us being able to digest the information that's there, understand the figures, understand where we are, and understand what mechanisms and actions we need to start to take internally on an individual, community level, so that it can have impact as we move along. So that's what we have in terms of testing. Yesterday when I checked, we had 732 tests that we could still do, and we are still pending 3,000 more tests to come in, and we had requested for 15,000 more tests that are pending a process, because you know just like test all the other items that are required for COVID-19 response, you will know that there is a waiting list now, and that's what's turning out to be a little bit of a headache as we move along. So I'm going to ask Ms. Bell, who has a listing of items that we have procured and items that are scheduled to come in, so that you can have a better understanding of where the health response is, and I think appreciate the work that happens at all levels of the healthcare system. So, Lizette?
Okay. We have been procuring the essential items, which includes the personal protective, and these include the clothing and also the other parts that make up the personal protective equipment, which includes the goggles, the face shields, mask, surgical mask, and N95 mask. So presently we have on hand, we have procured and have delivered 5,480 personal protective as it relates to clothing. We are to receive an additional 6,000 clothing by the end of next week, around the 13th of April. In addition to those, we have also procured 274 goggles, and we have pending to be delivered 18,274 of the additional goggles. Also, we have face shields. We have procured 1,300 face shields to date. Pending delivery, we have about 600 pending delivery. Non-contact thermometers, we have procured 375. Blood pressure apparatus, 94. We have procured 10,920 N95 masks. Testing kits for the lab, we have procured 50 kits and pending 150. The lab also required, in addition to the test kits, they require enzymes, which we have procured as well. We have procured 4 sets of enzymes, delivered, 2 delivered last week and 2 to be delivered today. We also have procured 150 boxes of the tubes that the lab also required for the additional testing. As it relates to equipment, we have paid for 8 mechanical ventilators, all 8 pending delivery. Also, X-ray machines, we have procured a total of 7 X-ray machines pending delivery, 6 wooden houses that is being used in the different districts, 50 infusion pumps, 6 patient monitors, and the regular face masks, we have procured over 150,000, 2 defibrillators, and 1 X-ray machine, 25 laryngoscope, and 1 video laryngoscope as well. Pending, we have 20 suction pumps, 150 IV stands, also additional PCR machine for the laboratory, and other supplies such as oxygen masks and cannulas, 2 blood gas analyzers, along with their cartridges, which would be able to test 1,200 tests, and also 15 electrocardiogram machines. So to date, those are the supplies, equipment that we have procured for the COVID-19 response.
Thank you, Lizette. I guess we're going to get through some of the questions here. It says update on the patients. Are they recovering? Yes, they are recovering. I think I had said that 5 out of the 6 patients were not getting any kind of treatment right now, and that's based on established guidelines. Patient number 7 is getting double dose of antibiotics, and that's not necessarily because of COVID-19, but remember I had said he was diagnosed with a community-acquired pneumonia, and that's why he is getting that double dose of antibiotic. I just got a note from CEO of Cardiusha. The patient is, in point of fact, improving. His vitals are stable, and he has improved from yesterday to today. And he is only on nasal oxygen, which is a little cannula they put for oxygen, and was chatting with his relatives via phone because no visits are allowed. Patient number 1 is asymptomatic, and patient number 2, they are both being swabbed today. Which hospitals or clinics are testing, and what are the protocols before coming to clinic? The hotline still remains the 0800 MOH care. I will ask also that people call that hotline specifically for Ministry of Health related issues, because there are many issues that people call us for in terms of the employment benefits and the paperwork that they need to be able to process. Doesn't come through us. It's 0800 MOH care. That's the number you need to call. And I know it's sometimes overwhelming, and you're calling, and but the amount of people that can call in a given time can be overwhelming. As is, I think there's 4 people right now manning that specific phone line, and then they will guide you through the process as to whether you need to come to the flu clinic that's established in all the major communities, or whether if there's a very, very high risk, then you will be have somebody go to your house to take a swab and take the due course of action, and that has happened before. We know that this virus incubation period is 14 days, but how soon can the virus be detected after infection? Can someone be tested too early? Yeah, you can always be tested too early. That's why all these people who are close contacts will have to be swabbed again 14 days after to, in point of fact, determine that they are negative, because you can have asymptomatic carrier. Incubation period, as listed in the literature, and it keeps changing. Earliest documented is 2, and then you have some evidence that says that it can be as late as 27 days, but it's still the range is still being between 2 to 14. What can the Ministry of Health and other NGOs do to address the psychological impact of COVID-19? Well, we do have our psychiatric nurse practitioners that have come up with a specific plan, not only for the general public, but for frontline workers. On Thursday, we should be having a question and answer segment specifically around the topic of mental health, because we do understand the anxiety level that people are having, the panic level that's understood in any crisis situation. And that's the crisis we are going through right now, but it's the after effect that you also have to be able to monitor, and people even being afraid. Before I came on this day, somebody who's having congestive heart failure, for example, and doesn't want to seek medical care, but we can't give you medical care at home. We need to seek the attention at the hospital setting. Do we have to pay upfront for testing or hospitalization? No, but it also doesn't mean that you can routinely just come in to get tested. Yeah, I mean, there is a process. Call this 0800 number and you will be guided through that process. No fees are levied, as far as I know, for hospitalization. Ministry asking for persons to cooperate with mapping. How if people don't know who are the patients? Just know patient 1, 2. Well, as I said, patient number 5, for example, is in is in the mandatory quarantine. I don't know that we need to know, give the name. The 4 people that were immediately in contact with him, those have been addressed. And the way it works is, you see, once we have an identification, we will go to the patient's home and start the mapping exercise there. Then the patient needs to be able to trace his timeline for the 14 previous days. And what we do is we verify it with the immediate contacts. I mean, if whoever lives in the same house, you also will help in that mapping exercise. It's an interview process that happens with everybody who you have been in contact with in the previous 14 days. Of course, as I said, some mapping exercises are more difficult than others. For example, the patient number 7, who is at Cardiusha, the last 6 days we know who he has been in contact with, because he's an enclosed space that you can monitor. So you have to go and map out the other days when he was out. So his family has been visited. We will find out where you work, where you were in those days, and that's how the mapping exercise is done. So usually it's the immediate contacts, people who are at your work area or at home, those are the more likely contacts that you will be more closely following up on. Will the Cuban professionals be dispersed throughout the country? Some have already gone to Carthusia. That started yesterday. We will go back with Ms. Bell and Ms. Matud, the Chief Nursing Officer, after we finish here to deploy the rest of the Cuban doctors and nurses throughout the country, with Cayo and Belmopan being the areas that are of more immediate concern simply because that's where the cases are popping up from. What is the procedure for when someone who was under quarantine complete their time, whether they were traveling or placed under government quarantine or tested positive for the virus and went on their self-quarantine? Do their personal effects get sanitized, for example, suitcase, clothing, footwear, as well as the location they were staying or their home? Yeah, there should be, for example, the hotel that has agreed, there is a specific process, and the hospital staff from Corozal helps in the actual sanitization of the area and the picking up of the garbage, because then that becomes, we are classifying it as what in medical terms is red waste. So we deal with that situation, and we would be able to guide persons how you go about sanitizing that area. So once somebody has completed that 14 days, they can reach out to us, and we'll send out either some communication or somebody who can guide you through the process of infection control, so that you are in the clear, if you will. And also the clear should come from the health officials. It shouldn't be you just coming out of your 14-day. And even if you have finished your 14-day, if at any point in time you eventually fall ill, you need to call us so that we can go and follow you up at that level. Would the ministry be willing to take in volunteers with a master's degree in a biology-related field experience in molecular biology lab techniques? Sure. We actually got somebody that the previous director of the lab, Dr. Morazan, wrote us an email on Friday. So she's coming on board. Of course, we would accept all the expertise we can gather. On Saturday, we had a long, lengthy discussion with people who have been in public health before, saying that they are willing to come on board at different regional levels. We are waiting for their names and phone numbers so that we can include them. What can businesses do if we would like to assist hospital with donations? What do they need? How can we assist? I have to thank you maybe tomorrow because I think Lisette, I don't know if you have the names of the people who have actually, businesses that have given to the procurement of some of the items. I know that some phone companies have come forward and donated phone credit. One of the poultry companies has asked us for a list of employees so that they can give baskets to health staff. Some companies donated bleach, for example. Some people have donated hand sanitizers. Yesterday somebody said that they're going to give us masks and stuff. Two things this can be done. One is you can either touch base, if you want to do it at the regional level, with your regional management team, which is in Orange Walk, in Dangriga, and Belmopan. And then that can be made available through the different management teams, so that, and again, it can be to health staff, or you may want to donate it to the region, hospital, patient care, whatever. If you want to do it at the national level, then you call us at headquarters, and we'll make sure that trickles back to everybody. We are keeping a listing because we intend to make that public. I mean, it's only fair that we are able to say who is at the task in this regard. Are there other pending tests for San Pedro? Only those who are in close contacts, and as I said, patients 1 and 2 are getting swabbed today. Will frontline doctors be using Cuban medication interferon for moderate or critical patients, or medications such as remdesivir, which is being scheduled to be approved soon? We got a note from the supplier of remdesivir that they are willing to donate it, but they made it clear that it was only going to be for 2 specific populations, pregnant women and children. We don't have interferon in country. We have used in the 2 hospitalized cases what is in the pre-approved, because it's not fully approved. There's no scientific research yet because it's not that extensive, for the use of double dose of antibiotic and chloroquine phosphate in our case. So those are available, and we just signed off on I think it's 100,000 tablets of hydroxychloroquine that is coming specifically to the Ministry of Health. It's not going to be available for the general public, because it can't just be and over-the-counter medication people can get. The persons who are linked to someone who have tested positive for COVID, are they doing a self-quarantine or monitored quarantine? If it's a self-quarantine, is there anything in place to deal with these persons who don't comply? Well, I think it's clear, the law is clear. You can be fined or taken to jail if you, in point of fact, not following the quarantine as recommended. And we are monitoring them. Some people call in, some people do FaceTime with their management teams. Some people snap photos. I have somebody who sends us, for example, their temperature that they take morning and evening, and photos of where they are. And I know people are getting desperate because 14 days can be a long time, but I hope people can understand the value of staying inside. What are the biggest obstacles in the mapping process? That's a trick situation because you have to rely on what people tell you. That's one, and also it can depend also how much you have moved in 14 days. If I am, for example, go from point A to point B for 14 days, it's easier because then I'm going to be able to tell you I just went to this specific place and I came back to this specific place. But if that's one, and you also have to rely on people's memory. I may not remember what I did, not this weekend, the previous weekend. So that might escape me in that regard. So that is one, and also the longer you have to draw out your mapping process. For example, if you fell ill today and I'm able to detect you early, then your mapping exercise becomes much quicker. 14 days of incubation still appropriate. We had said we are considering going up to 21, and when people have called us, we are suggesting that they go up to 21 days, which is part of the review we are having in terms of when we will swab you again after you do one swab and are negative. Would wearing a mask or even a shirt be beneficial to reduce the spread of the virus for everyone, since some might be asymptomatic? That's a discussion we had with the Nurses Association. I don't know if you want to discuss what we said, Ms. Bell, but I was following just very early this morning, late last night also, what are the recommendations from WHO. And WHO is still not saying wear a mask routinely, and they even have this little exercise of when people are not used to wearing a mask, how easy it is for you to have what's called cross-contamination, which means you still touch your mask and at some point in time still get the virus to you. For people on the street, it might be beneficial, but I would not perhaps recommend the masks that people are making. I know there's some discussion about making homemade masks for people on the street. It can be of benefit, but you also will have to understand that you can't wear a mask for 8 hours of the day. You can't be putting it on top of your head underneath your chin because then you have defeated the purpose of wearing a mask. I think for us, we're trying to be cautious in terms of just making a blanket statement for everybody to wear a mask.
Yes, for the healthcare workers, yes, we had a discussion with the Nurses Association as it relates to the different levels of PPEs that are required at the different levels of care. And similarly with the question with the mask and the type of mask and the different levels, so I outlined a document based on the WHO recommendations, where it depends if the staff is working in a low-risk area, what type of mask they are required to use, and if they are working more in a high-risk area, then we recommend the use of the N95 mask. And also, as it relates to the total attire for the PPEs, working in a low-risk area, you may not require the entire coverall, but you may require your mask and your face shield, and also a gown as a protective barrier. However, if you advance to other procedures, then you would be required to use your entire coverall and your mask and your goggles, and also your gloves. And so that is the direction we are taking as it relates to the use of the PPEs. However, we send out the document to the regions and also to the Nurses Association so they can peruse and also give their feedback as well.
Can the DHS tell us if the mapping of 1 and 4 shows that indeed they were at a party in San Ignacio on the 19th of March for birthday of wife of number 4? And this has become a trick situation without going into many details. And I guess that's part of what we were trying to understand and explain to people through the weekend. As is, we have a recording done of what was going on social media in terms of who was being labeled as patient 1 at that party on March 19th, where the female is basically begging and pleading with us that she's clarifying who she is, and she's obviously not patient number 1. In our mapping exercise done for patient number 1 and patient number 4, we did not find that connection, that is still a prevalent kind of situation happening there. So they are not, the people that are in the photos, and lots of photos have been sent to us, there's no connection that ties them there. As we have said, even internal to our mapping exercise, we were able to trace at what time patient number 1 arrived, what flight she took to San Pedro, who picked her up and took her home, and at what time that happened. So there is no other evidence that, and the patient that is being circulated in those family photos, and that's getting into people's private moments, if you will, is not patient number 1. How many mapping personnel are working, and who are they, and what qualifications do they have? Well, they include public health persons, people who have been trained in basic and some in intermediate levels of field epidemiology. At the regional level, we have people who have a master's degree in field epidemiology. Our surveillance officer is one of the focal points that guides that mapping exercise, and yesterday there were 3 different teams sent to San Ignacio to look for all the contacts of the patients as we were identifying them. So they do wear protective gear. They might not be the ones who do the swabbing, because remember, you have people who do the actual investigation, and I had said before, it's like detective work. They come and piece it all together, draw timelines, identify who got ill. We have managed to do that for patient number 6, for example, trying to trace back everybody who has been ill, even if you start at the beginning of March, as far as your memory can take you. What is the plan moving forward in the medium to long term? It's a difficult and tricky situation. We still are leaning now with the evidence we are finding that we perhaps have community or had an asymptomatic carrier in the Cayo area, and that's why the measures that were taken by the oversight committee for specifically the Cayo district, because what you're trying to do is contain, and as positive cases come about, you have to deal with that. Again, what you try to do is ensure that your system is not overwhelmed, because it would have been naive of us to think that we would never have gotten a case of COVID-19. It's just trying to ensure that your health system is not overwhelmed. And that question of herd immunity is a tricky question, because that would imply that we do absolutely nothing and wait for the disease to go through its normal progression. Unfortunately, COVID-19 can have a high mortality rate, can have a high infectious rate, and that's the reason why you cannot treat it as any of the other flus that we know. I mean, Italy has 12-13% mortality rate. Mexico is now reporting 5%, although they are saying their numbers could be lower, but they have not been able to identify all those particular cases. Will herbal medicine help? We have not seen any evidence that it helps, so I can tell you that I would recommend that be used. So I would tell you no for now. Patient recall registration, he said doesn't have any symptoms at the time. According to him, he is still in self-isolation. Yes, and I think the story, I didn't hear it. I got a snippet, a brief summary, because I can't keep track of everything that happens. of his story, and there's lots of things that I think can be pulled out of that. One is the growing stigma that we have, and that's the reason why we are trying to be here every day to explain to people that publicizing names doesn't necessarily help, because you recall the gentleman in Sarawi village maybe about a month ago, whose child was ill with something else, and he had gotten threatened. Patient number 3 has been very, I think he's keeping his self-isolation really, and ensuring that the regional management team is at all times aware of what happens in his routine day-to-day activities. But it's still we still keep getting calls of him being on the street, of him having people over to drink, and those kinds of things. I think he has sought to clarify that. Mind you, I don't know his name, because people also assume that I'm carrying around the names of persons or their addresses. That doesn't necessarily come to me. If we do not get in contact with anybody who's infected and have the symptoms, will we get tested? It's possible that an infected person probably touched simple things like a grocery in a store and then we catch it. Yeah, that can happen. That's why the necessary precautions are important, especially if you have ongoing transmission in a community, which is why we're saying minimize your risk of being outside. When you're outside, you still have to remain vigilant, keep your social distance, wash your hands, don't touch your face, because unfortunately it's not something visible that you can shy away from. So you have to assume that any surface you come in contact with outside is potentially an infected source. How many symptoms do you have to be tested, even after questioning travel history and such? At this point, it's uncertain if you have in contact with droplets from someone even in the same store. Yeah, we have expanded our testing, and we have said we had tested frontline workers who were in more contact with tourists, for example, some immigration officers. So we have expanded that testing. As I had said, anybody who has flu-like symptoms now reaching a hospital is being tested. People who are already in the hospital and develop flu-like symptoms are also being tested. Frontline workers, healthcare workers who are ill are being tested. And we have had random, not as many, but even samples that were already at the lab for something else were tested as a means of trying to identify other sources. If a person gets sick and needs to be hospitalized, will the person have a bill once recovered? I don't think we have discussed that, but I don't know that we should be, patients should not be concerned about that, or that shouldn't keep somebody then from coming to a health facility and say, okay, this is the reason. How do you provide food for those in quarantine? Can that same system be used for the frontline workers in Corozal who are having problems being sold food? Yeah, I'll make a note of that. That shouldn't happen. I would think that should have been resolved by now. Is it worth people keeping their own journals now, food they have been in contact with on a daily basis in case they get COVID-19? That would be the ideal, and as open as we can be about it. I think it makes our job easier. And I think it's also our responsibility. I mean, if we know we're in contact with, we should be able to say it to the healthcare worker. At the end of the day, it's making everybody's job easier and ensuring that the ones around you are protected. Can you specify what is considered low-risk area to your team? I don't know if they're asking about the geographic area. But if you're asking about the geographic area, don't assume that because you go from Cayo to Corozal, you have gone to a low-risk area, or to Orange Walk, or to Stan Creek, or Toledo, because they have not identified a case. Wherever you go, and I know we got a note earlier saying that people from Cayo are leaving the Cayo district before the curfew, going somewhere else. That isn't necessarily going to be the best approach. At this point in time, is stay where you are, keep your necessary precautions, because you're not really running away from the virus, if you will. I mean, you have to assume that COVID-19 is around us and it's going to be here to stay. It's not just going to go away after Easter or after May 1st. I mean, we will have to find a way of identifying cases, contain it, and give the prompt treatment that is needed. Can you clarify what you mean by double dose antibiotic for the therapy of COVID-19 occurring for a pharmacist viewing? Well, both patients that got IV antibiotics, they were put on a cephalosporin and azithromycin, and those are because they had also a pneumonia associated, so it's a bacterial super infection along with COVID-19. And one patient did get the chloroquine phosphate. And again, that's what is experimentally being used elsewhere outside of Belize. BCG vaccine, what are your thoughts? I think it's too early to say. I think we can just champion the fact that we do seem to have a very high coverage, good coverage of BCG, but I'm not going to bank on that. I am not going to tell anybody, okay, we have good coverage, it doesn't work like that. European countries, the US doesn't have, as a matter of fact, I don't think BCG is part of the vaccination schedule, which is why when you have Belizeans going to the US and get the PPD test, it's reactive. But we is because we have gotten our BCG vaccine. For them, they might consider that you have latent tuberculosis because their guidelines are different. But we are not banking on that. That's not a reason why we let our guard down. Similarly, if you're out of the Cayo district, it doesn't mean anybody's in the clear and you let your guard down. I mean, everybody is in heightened surveillance and you need to be doing the same thing as well. Does MOH recommend exercising as a coping mechanism and a person's allowed to exercise outdoors outside of curfew time now that the district is under quarantine? I think the guidelines said that you can't exercise,
Yes,
but
between 8 and 5. I'm sorry, between 5 a.m. and 8
yeah,
a.m.
but within the curfew hours, but outside of the curfew hours, as long as you are not running in a group and you are not running too far away from home, because if you live in San Ignacio and you're caught running in Belmopan, I mean, unless you're running a marathon, I don't see why you would be running around here. So it should be closer to home. But beyond coping, it also boosts your immune system. You know, there's many benefits of exercise. Are you testing the people getting locked up for breaking the curfew? Does putting multiple people in jail defeat the purpose? I agree. We are still trying to work ourselves around that. Easy thing for everybody, just stay home. I mean, that you're putting yourself at risk if you don't do that. If you are designated as a pneumonia case, does that mean you automatically require ventilator use? No. What does a ventilation service for a patient kick in? It will depend on the patient. It depends on how severe the patient becomes. And it's primarily the labored or more difficult breathing that the patient will have. So every patient will be different, and there are specific criteria as to when you're going to put a patient into a ventilation machine for support. Understanding that that can be a prolonged period. When you look at the experience of other people, it can be up to 3 weeks of intubation or ventilation support. And of course, the longer you're hooked up to a ventilator, the more likely it is that there will be some more severe complications with other things. How many doctors are available to intubate patients at the KHMH isolation unit? I know they have 3 internists. There are 3 more internists that came from the Cuban Brigade. I know that Dr. Hidalgo, who is an intensivist who is not currently in the roster, communicates with us. We're just communicating daily with him in assistance. Dr. Arriaga is, I think, heading the ICU unit now. We have somebody from private sector who comes and does shifts at Carl Huchner. My understanding of the patient that is intubated is I think they use the video laryngoscope, which they already have, which means that there's less risk to the doctor doing the intubation because it's guided to make sure you're doing it as a quick process, and then that's out of that. So that's what we have in terms of questions. I don't know, Ms. Belli, if you have anything before we start to wrap up.
I would just like to remind the general public as it relates to the use of the gloves. If you're using these gloves, ensure that you change them timely and you cannot have the gloves on for long periods of time. Also, please stay home so that the healthcare workers can be there for you.
Two other things that I'm getting. The mapping seems tedious. People need to be truthful. The mapping is very tedious. We have been doing this for more than 2 months. I am getting here personal notes in terms of the story that was published in reference to patient number 4. I mean, I can appreciate one side of the story being told. I am not, I think, in a position to be engaging. I can respect the grieving process of the family. As a clinician, I can tell you that I empathize with that, but once there's a due process, I will say what was said, because there's an allegation in there in terms of me being called, and that's not true. That's all I'm going to say in reference to that. There was no conversation on March 27th. And there's one thing that is slipping us, and that's because we have gotten caught up with COVID-19. But today is actually World Health Day.
Yes.
And I thought Ms. Bell was going to make a reference to it because she's a nurse. And we had the discussion with the Nurses Association, and we didn't brush on the topic. But it's the International Year of the Nurse and Midwife. And the topic for World Health Day was centered particularly around that. We were supposed to have hosted a regional conference for the International Year of the Nurse. Those are no longer in sight. We don't even have any activity, but we cannot forget the fact that the nurses and midwives are an essential part of the health system. They are the backbone of the health system. They represent 70% of the health task force that we have in country. So, and our job as a community is to make sure that you take good care of the nurses, because they are there to take care of us when we fall ill. So we can't forget that. We have to treat our nurses nicely, not only because it's World Health Day and it's their year, not only the day, but because of the value that they have and the importance and relevance that they have for the health system. So thank you. We should be able to do a session tomorrow. Hopefully we can talk about nutrition. And maybe on Thursday we will be able to do elements of mental health. That I know is supposed to be a long weekend, but I don't know. I think we have an extended weekend for the next 2 weeks, particularly in the Cayo area. So we'll try to keep you informed in real time, trying to keep the openness and transparency that the desk of the Office of Directors has always had in reference to the topic of COVID-19. Thank you very much.